Hello everyone. Today's video is about acute kidney injury. Acute kidney injury, previously termed as acute renal failure, described a reduction in renal function following an insult to the kidneys. Years ago, the kidney were very much neglected organ in the acute medicine. The recognition is decreasing renal function was often slow and action limited. Around 15% of patients admitted to the hospital develop AKI. AKI. So in this topic, what we'll discuss? We'll discuss definition, causes, sign and symptoms, what happens when kidneys stop working, and last not the least, the detection of AKI. So let's move further. Definition. So basically the key, we are just talking about the key points of definition. What we need to remember, we need to know the abrupt reduction of kidney function within 48 hours, absolute increase in the serum creatinine more than 50% from the baseline, or reduction of urine output less than 0.5 ml per kg per hour for more than 6 hours. So basically it is a reversible process. If we treat the kidney, the injury can be reversible. But if it's because it's acute case, acute kidney injury. If it is CKD but in CKD it is irreversible process. So this is the difference between CKD and AKI, and the main difference actually. So next, that is causes. Pre-renal cause. So causes of AKI are traditionally divided into pre-renal, intrinsic, and post-renal causes. So we are talking about now the pre-renal cause. So think what causes big problem in other major organs. In heart, lack of blood flow, myocardium causes myocardial infarction in similar fashion. 85% stroke causes ischemia to the brain. Same goes for the kidney. The major cause of AKI is ischemia, lack of blood flow to the kidney. So for this ischemia, pre-renal causes are hypovolemia, secondary to diarrhea or vomiting, and renal artery stenosis. These are the pre-renal causes. These are examples of pre-renal causes. Mainly pre-renal things. The main thing is ischemia to the kidney. So intrinsic cause, basically, intrinsic damage to the glomeruli, renal tubules, or interstitium to the kidney themselves. This may be due to toxins, drug, contrast, etc., and immune-mediated glomerulonephritis. So for the intrinsic, the causes are glomerulonephritis, acute tubular necrosis, acute interstitial nephritis (AIN), and rhabdomyolysis, tumor lysis syndrome. These are the intrinsic causes. And next one is post-renal causes. The third group of related to the problem after the kidney. So this is where there is an obstruction in the urine coming from the kidneys, resulting in things backing up and affecting the normal renal function. An example could be unilateral ureteric stone or bilateral hydronephrosis, secondary to acute kidney retention caused by benign prostatic hyperplasia. So the gist points, the causes are kidney stone, BPH, that is benign prostatic hyperplasia, and the next one is external compression of ureter. So next, let's move further. Sign and symptoms. Basically, from the definition, we know that low urine output, pulmonary and peripheral edema, and arrhythmia, and uremia. These are the symptoms, sign symptoms. What happens when kidneys stop working? Basically, I want to talk about this. It's backward to think about what kidney would actually do. Kidneys are primarily responsible for fluid balance and maintaining the hemostasis, basically. Therefore, two of the keywords AKI may detect are the reduction of urine output, that is oliguria, we can also say, and fluid overload, and rise of molecule that the kidney normally excretes, and maintains a careful balance. Examples include potassium and urea and creatine. So kidney basically responsible for electrolyte balance maintenance. So if kidney is not working, so there will be electrolyte imbalance, basically urea, creatine and potassium, most importantly. So detection of AKI. So AKI detection is very important. If we cannot detect the AKI early, so it will lead to a very dangerous for the patient, and it will lead to death. So we need to test the serum creatinine, and it will be very high for sure. Blood urea nitrogen, that is BUN in the short form, and urine output measurement we should check spontaneously. So thank you very much. I hope you like this video and subscribe to the channel. See you in the next one. Thanks for watching.